More than 200 medical journals from around the world are sounding an urgent alarm over climate change. They're warning about a potentially catastrophic threat to human health and urging the World Health Organization to declare a global health emergency. Hillary Johnstone is on this story for us from Ottawa. So, Hillary, good morning to you. What's behind this warning and this call for action?
Good morning, Travis. Well, these 200 medical journals say that we need to start thinking about our environment, about our climate, as being linked to human health, saying that those two systems are not separate from each other. And they're saying that they would like to see the WHO, the World Health Organization, declare climate change a global health emergency. So some really prominent medical journals, including the Lancet, the British Medical Journal, and a number of others that are all part of this call. And what we are hearing from a couple of different people is that they believe that this is necessary to try and make sure that world governments take this seriously. So this is a little bit of what we heard from Richard Smith. He's the chair of the UK Health Alliance on Climate Change.
The WHO is an organization of member states, and there are member states who potentially have a lot to lose as we move to an economy based on renewables and maybe an economy based less on consumption that doesn't destroy nature and emit so many greenhouse gases into the air. So when it comes to organizations like that, there are always difficulties.
So they're concerned here about everything from air pollution to biodiversity loss, rising temperatures around the globe, a number of things that they say are going to be really important, that countries, that researchers, that the WHO start to really look at in terms of their possible impact here on human health.
And I understand that they're also concerned about health impacts, Hillary. Tell us what this team of authors is concerned about on that front.
That's right. So they say that there could be everything from food and water shortages, for example. Air pollution, like I was saying, is another concern. And we spoke with someone at Harvard University about all of this, about the possible health impacts on humans because of a changing climate. Here's a little bit of what we heard.
Heat's impacts on heart attacks and obstetrical outcomes, air pollution's impact on respiratory disease. Of course, those are the mechanisms we think a lot about in medicine and public health. But it's important to also understand that climate change is a strain on our social fabric. We need healthcare systems and institutions to be working well. If our hospitals are getting flooded and impacted by extreme weather events, or our patients can't get to our hospitals, that has a major impact.
Now, for its part, Travis, the WHO, the World Health Organization, says that it does take climate change as a serious threat to human health, but it has also stopped short of declaring it a global health emergency, just like these medical journals, these 200 medical journals would like to see.
Okay, thank you, Hillary. Appreciate it.